Hello everyone, my name is Nadeem Khalid and I'm a junior doctor in Pakistan. In this video, we will be talking about esophagus and its surgical anatomy. Esophagus is a long, flexible, muscular tube of 25 cm in length. It extends from the cricopharyngeal sphincter or the cricoid cartilage at the level of C6 to the gastroesophageal junction, which is at the level of T11. The extent of esophagus is shown in this simple diagram from cricopharyngeal sphincter or the cricoid cartilage to GE junction. The esophagus is divided into three parts: the cervical part, the thoracic part, and the abdominal part. The cervical part is 5 cm long, whereas the thoracic part, which is the longest part of the esophagus, and it is 20 cm long. The last part, which is the abdominal part, is about 2 to 4 cm long. The esophagus, it passes through the diaphragm at the level of the 10 thoracic vertebra, and the final 2 to 4 cm, which is the abdominal part of the esophagus, it lies within the peritoneal cavity. You can see in this diagram, this is the abdominal part of the esophagus, which lies inside the peritoneal cavity. So the esophageal hiatus is at the level of T10. Do not confuse this with the level of the GE junction, which is the T11. The esophagus is loosely attached to the hiatus by a thickening of fascia called the phrenoesophageal ligament. Esophagus is not a straight tube, it is a flexible tube which can be compressed or narrowed at 4 different locations by the surrounding structures. And this makes 4 constrictions throughout the length of esophagus. The first constriction is the cricopharyngeal constriction, the second one is due to the aortic arch, the third one is due to the left main bronchus, and the last one is at the level of the gastroesophageal junction. This is a very perfect diagram. You can see that the distance of each constriction is measured from the upper incisors. The first constriction, the cricopharyngeal constriction, is at a distance of 15 cm from the upper incisors. The second one is at a distance of 22.5 cm. The third one is at a distance of 25 cm, whereas the last one, the constriction which is at the level of gastroesophageal junction, is at a distance of 40 cm from the upper incisor. These constrictions have very important clinical consequences. For example, a swallowed object can lodge at any of these constricted areas. Or when a corrosive substance is ingested, it will more likely cause more damage than elsewhere along the esophagus. And the reason is that it will move more slowly through these constricted areas. Now let us talk about the sphincters. The upper esophageal sphincter. It is an anatomical sphincter. It is about 4 to 5 cm in length, and the resting pressure of this sphincter is 60 mmHg. The lower esophageal sphincter is the physiological sphincter of esophagus. It is about the same size as the upper esophageal sphincter, 3 to 4 cm, and its resting pressure is between 10 to 25 mm of mercury. So the esophageal body pressure is between 40 to 80 mm of mercury during peristalsis. The blood supply of esophagus is divided into 3 parts. In the cervical region, the esophagus is supplied by the inferior thyroid artery, whereas in the thoracic region, it is supplied by the aortic and the bronchial arteries, the aortic branches of the thoracic aorta. In the abdomen, it is supplied by the inferior phrenic and left gastric arteries. This diagram shows the arterial supply of esophagus as described. The venous drainage can also be divided into three parts. In the neck region, the esophagus drains into the inferior thyroid veins. In the thoracic region, it drains into the hemiesophagus and the esophagus veins. And in the abdomen, the esophagus drains into the left gastric veins. Now let us talk about the nerve supply of esophagus. Esophagus has both intrinsic as well as extrinsic nerve supply. The intrinsic nerve supply of esophagus is via the myenteric and the Meissner plexuses. The myenteric plexus is also known as the Auerbach plexus, and it is found between the circular and the longitudinal muscle layer of the muscularis propria. The function of this plexus is the peristalsis. The Meissner plexus, as you know, is found in the submucosa. The extrinsic supply of the esophagus is via the vagus nerve. Okay, now we'll talk about the histology of the esophagus. This is the cross section of esophagus. From the inside, we have the mucosa, then we have the submucosa. Below the submucosa, we have the muscularis propria, and then we have the adventitia. The mucosa has further four layers. The topmost is the epithelium, which is a non-cornified stratified squamous epithelium. Then we have the basement membrane and the lamina propria. Just below or external to that, we have the muscularis mucosae. And then we have the submucosa and the muscularis propria. The muscularis propria contains the circular and the longitudinal muscle layers. On the outside, we have the adventitia. A quick question for you. What is the narrowest part of GIT? If you know, then let me know in the comments section.